Okay, everyone, welcome. Thank you for joining us this afternoon. I'm Stephen Pedigo. I'm the director of the LBJ Lab and a faculty at the LBJ School. This year, we are celebrating our 50th anniversary at the school. And throughout this year, we are recognizing the impact that our school has had within the walls of academia, but also looking to the impact that we've had in the real world. And as part of that, we're also thinking about how our school can sort of help shape conversations, discussions, and ideas as we look to the next 50 years of public policy education at the school. Today, we're launching an 8-week virtual series entitled LBJ in the Arena. It will bring together participants on the front line of public policy and governance to better serve and inform our citizenry during this unprecedented time of this global crisis. I'm pleased today to be hosting and kicking off our first session with Restarting Cities with my great colleague and mentor, Rich Florida. Richard, thank you for joining us.
It's great to be with you, Stephen, and Dean Evans and everyone at the LBJ School. Congratulations on your 50th. It's a pleasure for me to join you today.
Thanks, Richard. For this week, what we'll do, the way we'll sort of approach this program this week is we will have a great live discussion today with Rich. Rich is going to provide us a nice overview presentation of his thinking and our team sort of thinking about this idea of how this pandemic is shaping cities. We'll engage in a conversation. At that point, you too can participate in the conversation by chatting over your questions. We're going to ask that you use the chat feature as part of Zoom here to send over your questions to us. You'll also be able to engage in the conversation on Twitter using the hashtag LBJ in the Arena. And we encourage you to do that to share your ideas about things that you're hearing today. In addition to the live session that we have today, one of the things I'm also excited to share with you is a couple interviews that I conducted this week. I had the great pleasure of speaking with Travis County Judge Sarah Eckhart, who's a wonderful leader and just as importantly, a terrific representative of the school. She's an LBJ alum. And in that conversation, we chatted about what Travis County is doing, what the city of Austin is doing in terms of reacting to this pandemic. In addition, really looking at this question about the big decision of shutting down South by Southwest and how that really played into the city's response to the COVID-19 virus. In addition, I also had a wonderful chat with Peter Mullen. Peter Mullen is the CEO of the Waterloo Greenway here in Austin, and we talked about the future of public space. So one of the things that we're doing with those videos and other content is that on Friday, we'll release this video and those videos and provide you with what we think is a really great package of content to help shape your ideas and thinking around this. There'll also be some additional readings. All of that material will be available at the LBJ School's website and also available on our YouTube site. So with that, let's get started. I'm really pleased to be joined by my colleague and my mentor, someone who is very much so shaped my thinking of cities and also shaped, been a great professional friend and a great friend as well, Rich Florida. Most would say that Rich is probably one of the most well-known urbanists of our time. He's the author of 2 best-selling books, The Rise of the Creative Class and The New Urban Crisis. He's the founder and editor of City Lab and a university professor at the University of Toronto. Richard, thank you for taking the time out of your busy schedule today and joining us live from Miami.
From my bedroom, because I have 2 little kids.
Like many of us.
2 little kids, 2 and 4, who are running around like maniacs. It's great to be with you. It's great to be back in Austin, at least virtually. I love the city. My fondest memory, I have many fond memories of the city, but my fondest memory was back in 2003 or 2004, after I wrote the book that you mentioned. I was invited to one of the early incarnations of South by Southwest, before it was very big. And I remember I was staying in that wonderful Four Seasons hotel, and Asleep at the Wheel were playing in the morning time, and everyone's hair was wet, and public television station was broadcasting, and we were having orange juice and eggs, and I have such marvelous memories of your city. So, and such, what a great university and great school, you know, one of the great schools of public policy, the LBJ School. So many important things have been done at that school, and to see the school now taking on with your leadership, Stephen, in the Urban Lab. Now, the school has always had a history of doing great work in urbanism, but to see it reigniting is really fantastic. Yeah, well, you know, like most of you, I operated for most of the past, now almost 3 weeks, in isolation or in semi-quarantine. But anyway, I've been living that way anyway, because I'm an academic and I work from home and I work remotely and I'm an introvert. But, you know, Lord God, the anxiety was really terrible. It's only now abating. And I think with Stephen's help, folks, as a great and wonderful colleague and collaborator, I've been able to deepen my own thinking about what this virus means. I think those of us who work in the area of urban development and urban economic development, like many Americans, had collectively forgotten how important health crises like these or pandemics were to shaping and reshaping our cities. I never thought of it. I was born in the middle of a pandemic that claimed 100,000 lives now you know how old I am, 1957. My mom was pregnant with me and she gave birth to me, and they never told me. And I also lived through the '68 pandemic, which also claimed a large number of lives. And my grandparents' generation was ravaged by the 1918 Spanish flu. But again, I think it's made us all wake up and realize how important and potentially devastating these pandemics are, how they reshape our society, our economy, and our city. So we put together this little slide deck for you. I'll talk for a little while and then we'll take your questions. So here's kind of the outline of the deck. The effects of COVID-19 on our cities and our geography are in one way pretty straightforward, but they're not as straightforward as people think they are. And there are a lot of people running around saying, you know, everyone's going to abandon cities. New York City will have no one will want to live there. There'll be a great migration out of our big cities. And that's just silliness, to be quite honest. Our great cities will survive. They have always survived. We'll talk about that. What can we learn from the past? But nuanced and complicated. There will be parts of our cities or elements of the way we live and work, the way we go about our daily lives, that will change. And will change dramatically. Now, they may not change forever, but I think there's a period of adjustment, which we'll talk about, which is more than this immediate period of so-called lockdown or shutdown or social distancing, where our daily lives will be very different. I'll talk a little bit about an analysis we just did. Other people, Jed Kolko, the great urban economist, Ralph McLaughlin, there are many people now working on this. In addition to brilliant epidemiologists, about what are the factors that seem to leave our cities and communities more vulnerable or protective. How is that division also a division by where we live and by socioeconomic class? And then something Stephen and I think, have really taken the lead on, and something I'm very proud of, and proud of the work Stephen has done and we've done together, is how do we prepare our cities to reopen and battle this virus for the long haul? So at the big picture level, and you think about, let's just use the example of New York to be convenient. After 9/11, people said New York City will decline, people will move out, people are scared of terrorism. After the 2008 economic crisis, I actually wrote a cover story for The Atlantic about this. People said New York City will decline, the financial markets will shift away from New York and Hong Kong and London and move to places like Charlotte. They said this after Superstorm Sandy. You can go on and on. There's been predictions of this. But in fact, if you look back through the history of pandemics, they've never really caused our city systems to change very much. I mean, and I think the way to say this is, even before we had modern medical technology, even before we had antiviral drugs, even before we had hospitals that served most of us, and in most countries, socialized medicine that served all of us, even before we had the capacity to produce vaccines, even in centuries ago, the cholera epidemic in London, Black Plague in Europe, the pandemic of 1918, which, if you read the histories of places like Pittsburgh, workers jammed in tenements, working in factories in crowded conditions, just communities being annihilated. It never really altered this arrow of urbanization. Urbanization, the clustering of people and ideas and firms and businesses in networks like you have in Austin or in places like the Silicon Valley, is a much more powerful force than infectious disease. Infectious disease is a horrible force. It thrives off clustering. It transmits through clusters. But urbanization is the more powerful force. And I think what this is likely to do, unfortunately, if we're not conscious of it and if we don't plan for it, it's likely to reinforce geographic divides. We're not only dividing more by socioeconomic class, we'll get that in a minute, It's also likely to reinforce some of the geographic divides. Now, we might take a respite from that. Housing in cities like Austin or New York or San Francisco, for a little while, may become more affordable. Demand may dip. Economic crisis may, and that will give us an opportunity to reset. But this thing that we call winner-take-all urbanism, where a few places, and I would put the New Yorks, the Londons, the superstar cities, the LAs in that, but also the tech hubs, the Austins, the Seattles, the Bostons, where have really benefited. I think those patterns will be reinforced. Now, when I say class divide, what do I mean? I think what we're seeing now is a class divide that parallels the divide we saw in the early 20th century, in 1918 and 1920, leading up to the Great Depression. At that time, our society was highly unequal, but I want to make, it's not just a question of numbers. I want to talk about the way we live and the way we work. Back then, affluent capitalists, business owners, and managers were able to work on the hillsides of places like Pittsburgh and Detroit and in the Upper East Side around Central Park of New York. They were able to shelter themselves with outdoor. They had private hospitals to serve them. They had servants to bring them things. Where the factory workers, as I mentioned, worked in cramped factories, cheap by jail, supporting the war effort at the time for World War I, and living in tenements. What do we have today? Affluent professional workers, knowledge workers like ourselves can work remotely. Guess what? Guess what place in the United States has the largest share of its workforce that is able to work remotely? Silicon Valley. Isn't that interesting? With all the talk of face-to-face and, you need proximity, the largest number of people who can work remotely of any metro in the whole country, Silicon Valley. We're used to working in this way. Academics work remotely, tech workers, software developers work remotely. We get stuff delivered to us. We use Instacart and Uber Eats and delivery services. Whereas the frontline workers, 30% of our workforce, people who work in transit, people who work the buses, people who work the grocery stores, emergency responders, nurses, aides, I could go on, retail clerks, are exposed to this virus in their daily work. They're saving us, and they're exposed when they transit to work. So I think that class divide is going to be magnified, and hopefully it will give rise, it took a while. The 1918 was followed, unfortunately, by the roaring 20s. But by the 1930s, during the Depression and the war, if we came to our senses and rewarded our working class, I think today, hopefully we start to come to our senses. And some of these workers are organizing. They're calling on their employers, Instacart, Whole Foods, Amazon, to pay them better and get them the gear they need. Hopefully we will do that too. Right yesterday and today, and this will be up on the City Lab site, hopefully get edited, I did an analysis of the kinds of places that are more vulnerable. And let me just make this also concrete for you. A lot of conversation on the internet, on Twitter about, whoa, look at San Francisco, it's locked down. San Francisco doesn't have the propagation of this virus. They locked it down. They were so smart. Mayor Breed and Governor Newsom, people I adore. And look at Detroit, New Orleans. Look at parts of Florida. Look at parts of Texas. They didn't lock down. Yeah, it may be true that the lockdowns help, but this is really important. New Orleans and Detroit and even New York City. New York City has Manhattan, but those outer boroughs, the largest hit of this is happening in the Bronx, in Staten Island, in Queens, which is not a yuppie land of professional workers, which is filled with working class immigrants and poor and disadvantaged people. What are some of the factors that might cause a place like San Francisco to have better outcomes than a place like Detroit or New Orleans? Austin. What might cause potentially Austin to have a better outcome, or Seattle, or Boston? Class. There are more affluent people, higher income people, more highly educated people, more people who can work remotely. Childlessness, cities like San Francisco have been impugned because the kids have moved out and it's so darn expensive and they're childless. The two most childless cities in the country are San Francisco and Seattle. Children are vectors. That's why we close the darn schools. And cities that have more kids may be less vulnerable. Cities that have more kids, and ethnic communities, religion and social capital, things that we really care about in America, that the great scholar Robert Putnam has written about. What is the base case of social capital in the world? Italy, and particularly the northern Italy, the northern part of Italy. Deep social capital, deep civic ties, multi-generational families, highly religious. What are the vectors for transmission? Multi-generational families, churches, and temples. So I'm not saying these are good things. I'm not saying they're bad things. I'm not making normative judgments. But places that have deep social capital, tight religious beliefs, multi-generational families are more exposed. Health and fitness. We know that you're sitting in the middle, Stephen and Dean Evans, you're sitting in the middle of one of the healthiest places in the United States in the face of the earth, filled with cyclists and outdoor athletes and people who work out all the time. That matters. And look at other parts of the country, you look at places like Detroit or New Orleans or other parts of the country, and you see much higher levels of smoking and obesity and pre-existing conditions. And then the great divide of red and blue America. We've seen this time and time again. Like it or not, blue states and blue cities are taking this much more seriously. Now there's a correlation there. Blue states and blue cities have higher levels of educational attainment. They have more professional workers. They're higher income, for all those things. Whereas red states and cities are taking this less seriously and social distancing less. So I think all of those things factor in when we think about what, it's a little bit of luck. It's a little bit of were you a global destination? It's a little bit of were you a tourist place, like those parts of Colorado or the ski slopes of Europe. But there are other, and climate matters. The analysis that is coming out, no, it won't protect you completely, but the analyses that are coming out from Europe and from other places suggest that also climate matters. So there are a bunch of structural characteristics of places that make certain places that are poorer, that have more multi-generational families, that have older populations, that have more obese populations, more pre-existing conditions, lower incomes, more vulnerable. Now the thing I really wanted to talk to about very briefly, how do we best prepare and plan for this period of recovery? Look, folks, I don't want to be the bearer of bad news, but we aren't going to press a button after 6 weeks or 8 weeks, whenever it is, and just pop back to normal. I have unfortunately read the history of pandemics, and I've read the research literature. Scott Gottlieb, former commissioner of health under President Obama, has written eloquently on the phases of our recovery. Bill Gates is talking about this. We're looking at a period of anywhere, now it's hard to say, 6 months to 12 months to 18 months. I think 18 months is the outside period where we're going to be dealing with some version of this. Now look at the graphs. These come from a great study done of the 1918 pandemic. You can see there's a first wave, and these cities, New York and San Francisco and other cities did even better, like St. Louis. They put in social isolation measures. St. Louis even flattened the curve more than this. But you see that when they relax them, they come back up. In San Francisco, even more. Philadelphia was far worse. And it was the same kind of pandemic. It started in the spring. We had a summer respite. And then what happened was in fall of 1918, 1919, in winter, it got, in some places, it got even worse, more deadly. So, we're better now. We're already developing antiviral therapies and testing. And, this is why I think New York, in a way, if it had to happen anywhere in the United States, New York has fantastic scientists, fantastic medical centers, the ability to create surge capacity, to turn the convention center into a hospital, to turn Central Park into a hospital. They can mobilize quickly. But they're testing this out in real time. So if you listen to Fauci, he even says it, we have to learn from the virus. We can't do these things in the abstract. So antiviral drugs, therapies, therapeutics, and a vaccine. A vaccine, let's say, if we're lucky, by September, if it takes longer, 12 months. We got the summer to prepare, and that's the point. But at the same time that we work on the track of developing testing, because we're gonna have to test people and know who's immune and know how to isolate people who are at risk. We're going to have to ramp up our ability to develop antiviral drugs and vaccines. At the same time, we got to prepare our cities to get open. And Stephen and I have been working on this. 4 things we got to do. We got to institute, and maybe one way to think it, when you look at how China and Singapore are reopening now, when you see the pictures of that, people wearing masks, getting a temperature check at the airport, these are all important. Temperature and health screens. To know who has the virus, and health screens, antibody checks, serological checks to know who's had it. Personal protective equipment. Look, we've got to protect our frontline workers better, we got to get them the masks and gloves they need. The studies show that using a combination of mask, gloves, protective garb, and hand washing reduced the SARS virus by 90%. And it doesn't have to look like a hazmat suit or some ragtag bandana, which you see your grocery clerk or Amazon delivery person. These darn hotel chains and the airlines work with fashion designers to design fashionable uniforms, why can't we mobilize our fashion design community and our clothing manufacturers to make personal protective equipment that's safe and doesn't look like hazmat gear? And here's the example I'll use to you. Sooner or later, I got to take my little girls back outside. They're 2 and 4. Am I going to wrap them up in a surgeon's mask and rubber gloves? No. But if they had cute little, and don't laugh at me, Disney Frozen gloves that look like Elsa and Anna and a little dress that looked like an Elsa and Anna dress, they could go to the playground or they can go to school. Lord God, this is not rocket scientists in a country like America. When you go to a grocery store, you can design protective gear that is functional and that looks like workwear. Let's get with it. Designed for social distancing. We're already seeing this. I'm sure you're seeing this in Austin, where supermarkets like Whole Foods have tape on the floor and this and that and circles in Denmark. We're going to have to do a lot more of that and to do it better. Think about the University of Texas. You can move classes online, but how are you going to open to do business in the fall with dormitories and dining halls? You're going to have to think about how to design them and retrofit them, and then personalized service precision. We're going to have to move some services. I've been talking to doctors about this. How are they going to reopen their offices? Dentists, getting your hair cut, getting your nails done. Some of that's going to have to be done in a personalized way with the lower crowd. Anyway, we developed an action plan. We've got to really think hard about airports and big civic infrastructure. The retrofit on airports, but also arenas, stadiums, convention centers, is going to be way bigger than what happened in the wake of 9/11. We got to start now. If you want to reopen that convention center, if you want to even think about an event like a South by Southwest, if you want to think about reopening the airports, temperature checks, health screens, designed for social distancing, protective gear for employees and protective gear for participants. We've got to think with our anchors. Our anchors, like great universities and medical centers, have been key to the urban revival of the past 10 years. How do we engage our anchors, particularly our universities? How do we get universities thinking about how to reopen safely? And if they can't reopen safely, what do? We have online education, but what about all those kids back in their hometowns? Can we create something for them to do to engage their communities over the course of a semester or a year, kind of AmeriCorps for education and students that gets them involved in civic life? We're going to have to learn how to do remote work better. More of us are going to be doing it. We need to be better connected. Technologies like this, communities like Tulsa, which are embracing remote work, will have an advantage. We've got to think about our public space. Now we're blocking off the parks and playgrounds at a time when people need access to them. We know that this virus doesn't spread as much outside. Sidewalks are too narrow for adequate social distancing. People are not going to want to get on, unless we make our transit and trains safer. That's another area we're going to have to retrofit: the stations, the crowding, providing personal protective gear. But how do we make sure our streets and bike lanes are safe for people to walk and ride? Because people are going to want to do that. And if we don't do that, everyone's going to get back in their car. People are going to say, the hell with transit, the hell with trains. I'm going to drive to work. Everywhere is going to look like freaking LA. You know, we're going to have streets jammed that we can't believe because no one's going to want to take a train or transit. Biking and walking and living close to work will be an alternative. I've already talked about protecting service workers, and we got to protect underserved communities because it's the right thing to do. And if we don't, the disease is going to spread there and it's going to spread everywhere. And we have to ensure that our Main Street businesses and creative economy survive. You know, you can imagine Walmart, Amazon, big airlines, big companies, Uber getting with this, equipping their employees. You can imagine the grocery chains really mobilizing to make sure their people are safe. Main Street small business, the small mom and pop restaurants, how are they going to learn about design for social distancing? The small independent theaters, the art galleries, the things that make our creative economy survive, that create that sidewalk ballet. Imagine walking down the street in Austin or Los Angeles or New York 3 months from now with storefront after storefront shuttered because these businesses either couldn't make it financially and we're mobilizing to assist them, or don't know how to reopen safely. So at the same time that we provide the financial assistance packages, we got to provide the technical assistance, the small business technical assistance, and chambers of commerce and economic development organizations can mobilize to do this now. Anyway, enough from me. Like I always, Stephen knows this, I'm a professor. I come from the Fidel Castro School of Public Speaking, so I could talk to you all day. Enough from me. Let's hear from you. Thanks for listening.
Yeah. Hey, Rich, thanks for that overview. I think it's a nice frame for today's conversation and a lot of the things I think that you've been thinking about and really some of the conversations that we've been having with both. elected officials out there as well about this. I think one of the questions that's came up in the chat, and it's something that strikes me. In fact, I, as you know, I wrote a piece for the Dallas Morning News that will run this week about this, and that is this relationship between cities, states, and federal governments, right? In terms of, and you've written a lot also about this idea of this question about localism, the devolution of power. How do you see this how do you see, as you walk through that action list, how do you see this playing out between states and cities, as well as within that? What is the role of the federal government, which is kind of, as you know, been kind of not there the best that it could be? What's your thoughts on that?
So I have a fear and a hope. My fear at looking at the track record, the historical record of previous pandemics, is that they reinforce centralization and they reinforce authoritarian impulses. People get scared, they get frightened. They want a powerful central figure, a populist and authoritarian to protect them. That's the history. So we tend to centralize. My hope is that we finally learned our lesson. I fear we haven't, and I hear this not only on the right, but I hear it from the progressive left. In the midst of the most dysfunctional federal government in modern memory, and not just our president, a polarized, terribly polarized Congress. I could, but I'm not going to blame either side. I'll blame both. We're still saying we need a more powerful central government. We need a better central response. The thing that's saving our asses is state and local initiative. And even if some of the red states don't get it, local governments are responding. Governors like the governor of Michigan, Governor Cuomo, Governor Newsom, Governor Whitmer are emerging as real heroes of this battle. And so I would hope that we would learn that lesson and devise a more decentralized government system where response like this can be ported down to the local level where it is most effective and coordinated. Maybe we end up making the CDC an independent agency. That's what I'd like to see. The CDC and the health agencies become more like the Federal Reserve, not so highly politicized that, and I think, from our world, Stephen, at the local level, really coordinating much better between public health professionals and economic development professionals and urban professionals. That's something the Urban Lab and we can do in our work. We kind of forgot that because we never dealt with this, but making public health part of the regime of study, if you will, integrally related to urban economic development, that would be important. But yeah, I think empowering the local to respond better and limiting the damage a dysfunctional national government can do. And I actually think, people are impugning the United States. I don't think the United States is going to come out so bad on this one. I really do. I think the ability to mobilize, to bring resources to bear, to mobilize our health sector, to create a vaccine, I don't know. I put my money on the US. I hate to say that as dysfunctionally we've been, but I put my money on the US, even with the tragedy we're seeing, to help us fight our way out of this. So I think there's something in our wacky dysfunctional system, the local initiative, that will help us and help the world.
So Rich, one of the things we've been talking about here in Austin, but also I know in my class, in Professor Waxman's class, is the rewrite of Code Next, which is our land use planning here in Austin. It's been a very controversial planning process, and it's ongoing through this. How do you think this pandemic will have an impact on the way that we think about public planning and land use? Will it reshape? Should it reshape? Could we swing one way too far to the other?
So I think when I said nuanced and complicated, the macro trends, the reinforcement of winner-take-all urbanism, the big incumbent cities, the superstar cities, the Austin Tech Hub seems obvious. The way in which it reshapes the layout of our cities, the design of our cities, our daily and working lives is much harder to predict in advance. But here are my thoughts. You're going to want to be in walkable and bikeable places. Demand for walkable and bikeable places will go up because traffic will become more congested because people want to use cars and people will be scared of transit, number one. Two, I think there's going to be more demand for private amenities. I already hear it. Oh my God, I don't want an apartment. Oh my God, I'm a New Yorker. Why do you think the New Yorkers are running to the Hamptons and to Hudson or wherever? Because they want some place to go outside. So I think demand for private amenities is going to go up in a big way. Now, I don't think that means everyone moves to the ex-urban fringe, but I think that could mean retrofitting condos with outdoor spaces. I think when you shut down all public amenities in buildings and shut down all parks, people are going to say, well, I have to go somewhere. And if this thing's going to be around for a while, I think it will impact zoning laws and building codes. One of the things that we know is that zoning and building codes have emerged in response to previous health pandemics. Just think about requirements for ventilation and air and sunlight in the New York early building codes. Yeah, and I think now is the time that we have to think about zoning and building codes for public health safety, and to really think about how those are going to impact the way the shape of our cities is. I think this will have, and we don't know, we can't know in advance, but this is going to register, and it's going to register in every part, the way suburbs are planned, the way rural areas are planned and zoned, and the way urban areas. But I think the one thing to keep top of mind is safe ways of commuting and getting around, and the increased demand for private amenity or safe amenity. You know what I'm saying? An amenity where you feel safe using it, I think, and whether that's a bike lane or a bike path or your own backyard, those things are going to register.
So all of that makes sense to me, in a lot of our conversations about the way we would sort of think about space, think about this idea of planning. And that seems to be very centered around people like you and I, right? Who have the resources to be a bit more flexible in our work. What about this? What about the impact of what you just described on this question of equity and inclusion in our communities? Because as you know, much of the field of urban development has been centered on not just how we build vibrant communities and competitive communities, but how we do this in a way that's equitable from the bottom up. As you've thought about this question about this, the role of public health and the role of space and all, and the things that were in the deck here, what is that lens of equity that we can apply to this? How do we ensure that we don't? Obviously, the protective gear and all those things make sense. How do we ensure that that all people a part of our community get to sort of participate and have access to these amenities that you've described?
So let me distinguish between two kinds of less advantaged groups and the challenges we face. The first are the service workers, the gig workers, the frontline workers who we now know our life depends on. If we didn't know it before, we now know our health and safety and security and ability to get stuff to live depends on. They are the new working class. They are 30% of the workforce. If you take all of them together, they're 45%. But if you take the frontline ones, they are organizing. And in ways, this reminds me of 1918. Now, it took another 20 years before their struggles became legitimated and institutionalized in the New Deal and the post-war social compact, which gave workers the rights to collectively bargain and increase their wages and created a new working middle class. But they're starting. They're going on strike. They're collectively bargaining. They're registering their complaints. I mean, they're demanding the gear and they're demanding battle pay. I think now, I hope it takes shorter time. I hope it doesn't take 10 or 20 years. But I hope all of us, in addition to tipping people, in addition to making sure we tip those people now, I think they're going to make their demands heard. And look, for me to pay a little, or you, or all of us to pay a few bucks more for a delivery, it's not like even paying more for a car. This is rounding error. So yeah, I hope, and we accelerate that. And I hope our left progressive movements adopt that. The truly disadvantaged are a different kettle of fish and quite terrifying. I mean, the conditions in which impoverished people live in the United States are horrifying. Horrifying from an equity point of view and horrifying from a public health point of view. You see the hospitals in the Bronx with the refrigerated trucks pulling up. You see them in downtown Detroit. It's hitting hardest at these places. And I think we have to realize that that's ethically and morally unjust, and it's a healthcare nightmare. So maybe out of this, we do get something like I would have never said this a month ago. Maybe our social safety net becomes stronger. Maybe our medical professionals demand better health coverage. And maybe we get something like a universal basic income. But hopefully on the left, on the progressive left, these will become things that are debated. And I hope, and I mean, I'm a big supporter of the Green New Deal. But let's make the Green New Deal even more concrete. Let's make it a new deal for healthcare and safety and health and safety. And I think it's something that all Americans can resonate with, leadership that says we're going to make sure all of us are safe. We have nothing to fear but fear itself, to quote FDR. So I think equity can come in, but it's got to come in a different way. It can't just be a moral issue. I think the way it's going to register is something that helps us keep all of us in our society, in our cities and suburbs and areas safe and secure.
Mm-hmm. So thinking about the virus, we're at a university. We've now moved, like all universities, online. Thoughts on maybe a little bit deeper dive on sort of how universities should be reacting or thinking about this pandemic, maybe even the role of that, again, bringing that equity lens into this conversation about sort of what does online education look like as we think about the equity implications for the way that we're expecting people to be to get access to resources in school and all those types of things. Thoughts on how education gets shaped here?
Well, finally, online education is going to become a reality. You've heard me say this. Even when I've tried to develop online education, or I had developed a MOOC, I got very little credit for it. I was told not to do it. It doesn't count. Finally, I got it to count a little. But there were real rigidities in some universities, not all, to doing this. And some, like the University of Arizona, Arizona State, incentivizes this, but others didn't. So I think online education is going to be a fantastic boost for this. And we know we can do parts of it well, right? Parts of it we can do very well, and other parts require in person. Maybe we'll get hybrid models, right? Of online, instead of me regurgitating a lecture with PowerPoint slides in front of the class, we tape that up, we make it available. And then, like you know how to do this. We do more immersed learning, service learning. We do project courses. We go and actually work on a thing. I think the retrofit of physical plant is going to be harder. I was talking to my sister-in-law, who's a high school principal, the other day, and she said, "How's my high school going to reopen?" I said, "I don't know." She said, "How am I going to reopen my lunchroom with 300 people?" I said, "You're going to have shifts of 50 at a time, and you're going to schedule them." The classrooms, getting the class sizes down under 50 is doable. You can break up but the question is that I think if I was a university leader, how do I get my dormitory and dining hall safe and secure? If I had a kid, and I have nephews, nieces, I wouldn't send them back to college in the fall. I'd be terrified. The dorms and the dining halls are transmission vectors. So a couple things. We can start to design dining halls that can be scheduled for kids to go back in waves, if you will, in stages. And we can think about retrofitting dorms. And maybe in the dorm, we do temperature checks. We do regular antibody checks. They're going to have these things that are pretty quick. And when a kid gets sick, we have a part of the dorm where they go and it's a nice part of the dorm where they go and isolate, and we keep the things up and running. But we've got to make parents. Remember I said about the flu in 1918, it took 2 or 3 years, maybe more. Parents are going to be scared to death, even though their kids want to go back and their kids are protected and young people do better. If I was running a big university system now, this would be top of mind. And here's what I'd be doing. Whether I ran an airline or had a small business group, I would get together my local designers, my local architects, my local interior designers, my local urban designers, my local fashion designers, and say, draw me up a plan. Maybe it's how do I do the airport? How do I do the dorms? How do I do small business? I put together a task force or a working group of people, and I get the medical professionals involved. When you talk to doctors and dentists and pediatricians about how they're going to reopen their office, they're 10 steps ahead of us. I'm not going to have a waiting room. People are going to schedule appointments in advance. They're going to be taken right to a private room. They're going to have a pre-screen and a temperature check. They're not going to be vendors coming in hawking goods. They're going to be in another part. We're going to have everyone equipped with personal protective gear, including the patients. Okay, well, we can do that. That's not that hard. We have a summer to get ready. We can reopen a way that's not as hectic and as crazy, and everybody with a DIY mask and a poncho on. And painted circles and tape on the floor. We can actually mobilize and set up working groups and task force of professionals to get ourselves ready to reopen in a way that's safe and secure.
So Rich, just time for two more quick questions. One of the questions that came up in the chat box a couple times was, we're in the state of Texas. 8 in 10 of us live in urban areas. 20% of us live in rural communities. A lot of the things you've talked about is the impact of what this would have on cities like the size of Austin or New York. Thoughts on how the pandemic is going to impact rural communities and maybe the way that some of their leaders or even our state leaders should be reacting to this?
Well, smaller communities are being very hard hit by this. If you look at the New York Times data, Albany, Georgia, that place that had that terrible outbreak, is the hardest hit community in the United States. Harder hit than New York, harder hit than Detroit, harder hit than New Orleans. If you look at rural counties, now in general, there's been a density decline. The most dense places got hit the hardest, and then the suburbs, and then the small suburbs, and then the ex-urban fringe, and then the rural areas. One part of rural America has been really hard hit, rural high amenity recreational counties. Places that have a lot of tourism. The Colorado Rockies, and you Swiss Alps and Italian Alps, we can go on this. These places that are quasi-rural in their scope, but they have a lot of tourism, they've been just nailed. And I think the problem in rural areas is that they don't have the healthcare delivery system that makes it possible to respond. So as this diffuses across the country, and hopefully the lockdowns have really helped, It's going to have a harder time in rural areas adjusting. So I think this pandemic is already hitting rural America and small town America. We focus on big town America, but I think it's already hitting rural America. And by the way, the Daily Yonder, run out of Texas by Bill Bishop, former Austin statesman writer, run out of, I think, Marfa. I'm not sure exactly where Bill runs. It has been the best reporting on this coming right out of your state.
Yeah, it's interesting you say that, because the IC Squared Institute here at the university has been doing a lot around rural development, and under Art Markman's leadership. And Art and I had a conversation last week, and the ideas that we were suggesting were very similar to this, is that one of the challenges with rural development is that we've used tourism and recreation as a way to sort of think about rebuilding those communities, and not done enough really to think about how we build real sustainable economies, just like we've done in cities, around exports, around real goods and services that we can push out, the use of universities, our community college systems as well. And so I think this is an interesting time for rural communities to also kind of look deeper inside and think about how they're going to react to this.
And anchors like universities and medical centers to figure out how they're going to serve and connect. And the other thing I'd say is get ready now for a wave of rural gentrification. I think that this is where you're going to see a different kind of gentrification now. If there was a little to begin with, the Marfas of the world, the Hudsons of the world, the California equivalents, the Colorado more remote places, Northern Michigan, Traverse City, Michigan. I can go down the list of these places. Get ready, because when people get scared, and the people who can work remotely are going to say, I'm going to go to one of these places. So I think you're going to see a wave, as well as the superstar cities come back. I'm going to see in adjacent areas, 3, 4, 5 hour commutes. These rural amenity places are going to see a wave of gentrification. So get ready for that too.
So last question for you. As you think about this pandemic and sort of the next 12 to 18 months out, what scares you? What makes you really sort of worried and keeps you up at night? And then the flip side of that is, what gives you great optimism of that we're going to sort of see ourselves out of this?
I'm not that scared anymore. I was scared. I'm not that scared anymore. What used to scare me was my kids, but now I realize they're so young that it's not registering, that they love being home with mom and dad. They love their little online classes. They don't even know. And, my fear was only for them. And so I'm not scared about that. I'm not scared for me, I'm not. I've made a lot of achievements. I'm not scared about that. I think we're going to pull through. I think we're going to end up, look, I don't want to sugarcoat this or be a Pollyanna. I think we're going to have a good public health achievement. Maybe I'm just looking on the bright side and can't look at the downside, and it's so much tragedy, but I think we're going to come out of a horrible thing, hopefully in much better shape than we did in 1918. And we're going to look at our cities and states and our frontline heroes. What worries me is the zombie world that we're going to enter for the next 12 to 18 months that we don't know enough about, and how we're going to get through that. And maybe all of you are thinking this, like our little conveniences, like going to the coffee shop or going to meet a colleague for a drink, that might not be there. And that's what really, and I know it's only temporary, man. You look at somebody battling a terminal illness, or, I had a brother-in-law who suffered a stroke. Hopefully he's now recovering. Cancer survivors, you look what they go through, and it's a long time. In the scope of world history, 12 to 18 months, but it's kind of, it's jolting when you think about taking the kids to the playgrounds in a little Disney Frozen mask and gloves, or they can't go back to school in the fall, or your nieces and nephews, or, loved ones who can't go back to college. That's what worries me, and how we'll adjust. I'm not worried about social unrest. I don't think the society is going to explode. I hear all of these, doomsayers. No, I think we'll adjust. The other thing that worries me is how quickly we forget. And Lord God, folks, we have this hyper-materialist, celebrity kind of dumb culture in our society that, most of us go, oh, blech. But what I worry about is the 1918 pandemic was followed by the Roaring 20s. I want this to do some good and make us more civically and socially minded, and get us away from this hyper-materialism. But I look back and go, that's not what happened before. And most of all, I hope we don't collectively forget. That's what what keeps you up at night is that we forget about this and it comes back to bite us again. And I'll just go, what I opened with. I was born in 1957 in the middle of a pandemic. Nobody told me. I lived through the 1968 pandemic and had no idea. Like, oh my God, hopefully because this isn't the last one. These are happening and they're accelerating. You know, if you look at not only HIV AIDS, SARS, the swine flu, we can go down the list, MERS, Zika. Many of those were contained. HIV AIDS is a horrible tragedy, horrible tragedy. But hopefully we learn from this one and we get ready for the next ones, and we're ready for them when they occur, so we don't forget. I'm worried that we're going to forget about this too soon.
Rich, thanks for joining us today. I know you wanted to share your email with the group in case there's other questions. A lot of questions that came in that we didn't get to, but if you want to share your email, go for it.
I'm florida@creativeclass.com, florida@creativeclass.com. As Stephen knows, I do try to respond to every single email I get. So if you have questions or comments, suggestions, ideas, send them along.
Cool. Everyone, thanks for joining us today. We appreciate the engagement, appreciate your time. As I mentioned earlier, this video, along with lots of other stuff, will be available on Friday on the LBJ website. For next week, my colleague Michelle Dyke is going to lead us through a conversation looking at the impact of the pandemic on the prison system here. In addition to that, we've got another great on-demand video, which will feature my colleague Don Kettle interviewing Admiral Thad Allen about the recovery efforts that happened around Hurricane Katrina in New Orleans. So we got a lot of great content coming out about this, and hope you'll check us out at the LBJ website. Have a great afternoon, everyone. Thanks for joining us.